Good afternoon, doctors. On behalf of Hetero Healthcare, I, Dr. Prashant Khandeparkar, welcome you to this webinar on intimate hygiene. Doctors, as you know, at Hetero Healthcare, we market products in multiple therapy areas like gynecology, dermatology, pulmonology, gastro, and orthopedics. We have a very strong R&D, and we try to develop products keeping patient benefit in mind. Our endeavor is to improve patient compliance, and ultimately, when patient compliance is good, the clinical outcome should be better. We have developed NSAID patches, reverse segment patches to bypass the oral route and hopefully improve patient compliance. Gynecology, obstetrics, and IVF is an important therapy segment for us at Frenza. And apart from conventional tablets like Didropal and Mylutin, we also market products for vaginal health, as you know, Feminora and Pelletri. Recently, we have introduced a vaginal film under the brand name Celora. The film contains lactic acid along with fructooligosaccharides, and the purpose of this film is to correct the vaginal pH and maintain pH so as to protect vagina from infections. To speak more about conditions requiring vaginal film, the product, and share clinical experience, I have pleasure in inviting Professor Dr. Girija Wagh. Madam, welcome. Madam is Professor and Head of the Department Gynecology and Obstetrics, Bharati Vidyapeeth Medical College, Pune, Director in Primrose Wellness Care, Senior Consultant in Cloud9 and Apollo Hospital, Pune. Madam is Faculty Professor at Ogash International Expert General Coordinator 2016, Vice President India Chapter Getosis since 2014, and Foxy Vice President-elect 2024. Welcome, Madam, and over to you.
Thank you, sir, for that very kind introduction, and good afternoon to everybody. And I want to congratulate the Hetero Health for giving us this platform here to express something important. And about that, I want to congratulate Hetero Health for continuously coming up with some things which are novel. I don't know what I have project here. So I just want to know whether my presentation is seen. Are you able to see my presentation?
Yes, no. Madam. Yes. Yes.
Was it available?
Yeah, it was. We could see that.
Okay. Okay. I don't know. Somehow it is not available to me. I'll just check. 2 minutes. Yeah. You can see the presentation now. Correctly? Yeah. So today at this particular platform, we are going to focus more on looking at the intimate health management. We know now in the recent past, there has been a lot of awareness which has come up with the menstrual health and hygiene. And today we are also going to be looking at generally a lot of things in women which are kept in confidence, or sometimes they are not ready to share, and sometimes they suffer in silence. And one of those important components is the intimate health management. Thank you, Dr. Bhaveshi, for giving me this wonderful introduction. And we all know that intimate hygiene is all about keeping your private parts clean and hygienic. And daily gentle cleansing of the vulva is an important aspect of feminine hygiene and overall intimate health. Now, for all these reasons, actually, the vaginal pH happens to be a key factor, and it itself has its own self-cleansing mechanisms. And then sometimes you will see that usually there are normal vaginal discharges which are clear, white, odorless. And these are the ones which ensure that the vaginal health, the vulval health is well maintained. However, if the discharge becomes smelly or different in color, or is causing itching and soreness, chances are high that it must be due to some infection. And the pH of the vagina, which is determined by the estrogen background of the woman, plays a significant role in the intimate hygiene. And that also helps in ensuring that the vaginal flora is properly maintained, or whether it's depleted, or whether it's got destroyed. So vaginal flora, as we understand, is a very, very important and very crucial to maintain the vaginal health and the environment. And these microbiota or microbiomes are the microorganisms that colonize the vagina, which are containing both the good and the bad bacteria, which coexist actually. And usually, whenever this balance topples, it is the same. Maybe the good ones turn into bad ones, and that's where the problem occurs. The primary bacteria of a healthy vagina are of the genus Lactobacillus, and these are known to protect against the pathogenic species which may cause infections such as bacteriovaginosis or maybe fungal infections or protozoal infections. So the acidic pH of a healthy vagina ranges from 3.5 to 4.5, and the increased acidity forms a natural protective shield to prevent harmful germs and other microorganisms from intruding. When the pH becomes more than 4.5, the vagina becomes susceptible to vaginitis, inflammation of the vaginal tissue, and the lactic acid is important to support the maintenance and the restoration of a natural healthy vaginal flora. The vaginal pH is therefore determined by the sum of lactic acid production by the vaginal mucosa and the microbial flora. So it's very, very important to understand that to have a healthy vagina, it is important that one has a balanced pH. Now, how does this pH get maintained correctly? It's because of the estrogen hormone, as I mentioned at the outset. This estrogen hormone causes increase in the glycogen content of the vaginal mucosa, and the glycogen is broken down by the lactic acid bacteria, the lactobacillus that we spoke about just now, converting it to lactic acid. And this lactic acid helps in hampering the growth of the pathogenic bacteria, and the colonization of the lactic acid bacteria is a continuous process which is going on. And it induces the growth of lactobacilli, creates an acidic environment, and this creates a natural protection system which prevents infections and maintains the vaginal health. Now, as we understand that it hampers the pathogenic bacteria, colonizes lactic bacteria, induces more lactobacilli to grow, and creates an acidic environment regulating the vaginal pH. The normal vaginal flora, acidic vaginal pH, and vaginal discharge are all the components of the innate defense mechanism that protects against vulvovaginal infections. So what happens when there is an infection? So there is definitely a disruption in these mechanisms which maintain the vaginal health. And these are many predisposing factors and many actuals or acting factors which would happen. So the risk factors such as the woman's age, because as the age goes on increasing or in a very young age, estrogen may not be as productive as would be in the reproductive age. Lifestyle, well, sometimes there are substance use disorders, or maybe, other, sitting for a long time, or some sort of stress can also cause problems. And these can give rise to reduction in the vaginal lactobacilli, and H2O2 and lactic acid is reduced, which decreases in concentration, and then the pH of the vagina becomes alkaline. And this promotes the growth of pathogens. And the vaginal infections, then you can smell typically fishy odor, discharge, which is known to be associated with sexually transmitted infections, local inflammations, which can cause infertility. So the menstrual cycle, if you see, during that particular cycle, the blood is always of a pH of 7.4. And most women's bodies can handle the difference, but some find that they are prone to infection during or after menstruation. An antibiotic medication can raise the vaginal pH because it kills all the bacteria, both good and bad. And birth control pills can also change the vaginal pH for more people, which is potentially leads to infection. So we should be aware of the fact that whenever we are giving antibiotics for some other reason, it always can cause a potential disruption of the woman's vaginal health. And douching is a method of cleaning the inside of the vagina. It's different from washing the outside of your vaginal area with soap and water. And douching usually involves squirting a pre-packed fluid mixture into the vagina with a tube or other tool, and this process can raise the vaginal pH and should not be really practiced. And lubricants are reduced dryness in the vaginal area during sex. Some lubricant products such as have a pH which is higher. This higher pH can kill the healthy bacteria and lead to an infection. Women who are breastfeeding or menopausal, their hormones, especially estrogen, play a large part in keeping the vaginas healthy and the pH acidic. When women breastfeed or start menopause, estrogen levels are low, and sometimes resulting in conditions like vaginal atrophy and causing higher pH. And we are various, therefore, therapies available, and a lot of market is investigating this, where we find that there are vaginal douches, pellets, or maybe oral medications, which would help to invest into trying to regularize the vaginal pH, but none of them seem to be having any long-lasting results. So there are certain gaps which need to be filled, and there are some products which are there, like lactic acid wash will wash out even the good bacteria which lack adherence to the vaginal surfaces. Suppositories would cause leakage issues due to use of high suppository bases inconvenient. Vaginal gels are messy application, accurate drug delivery not possible due to sticking of gel on the hands applicator. And soft gel caps and ovules where patients are quite at discomfort due to non-flexibility of the material. So for this reason, we need to have a right therapy option for sustainable result in balancing the vaginal pH. And this therapy is offered in the form of lactic acid vaginal films. Now, these lactic acid vaginal films have certain very important advantages, such as long residence time due to use of bioadhesive polymers, lack of leakage, patient comfortability due to film flexibility, easy storage, increased stability at the extreme storage conditions, faster drug release, and convenient application. So this is what the Hetero Health has brought about as a very, very pioneering action in the vaginal care to bridge the therapy gap, a revolutionary therapy in the vaginal care management to balance the pH. And this kind of a film is available for the first time in India by the name of Silero, which is a lactic acid vaginal film of 220 milligrams. And this particular film is definitely a panacea and a good health option for maintaining vaginal health. Now, what does this contain? It is known to restore the imbalance of the vaginal microbiota and restores the vaginal pH by its presence of lactic acid. And it also contains fructooligosaccharides, the FOSs, which promote the growth of lactobacilli and secretes the antibacterial substances and balances the vaginal pH. So this is that very, very revolutionary lactic acid vaginal film, which is faster and accurate drug delivery, longer adherence to vaginal surface due to bioadhesive polymers, and flexible film ensures patient comfort. So how does one use it? Patient should naturally wash your hands first, and then should cut the pouch from all the three sides, and should gently roll the film on the dry fingers, and should be in a comfortable position inside the film, inside the vagina, and should wash your hands after the insertion. So this is how the
vaginal pH imbalances signals many vaginal diseases. The core cause of these issues is nothing but imbalanced vaginal pH, which remains untreated. The therapy options available today don't give long-lasting results in maintaining the vaginal pH. To bridge this therapy gap, Hetero Healthcare is introducing a revolutionary formula in maintenance of vaginal pH. Hetero Healthcare, pioneers in vaginal care, knows the best and offers the best. Introducing a revolutionary therapy to balance vaginal pH. First time in India. Tomorrow, lactic acid vaginal film. Bow for healthy vagina. Following are the steps to use Silero lactic acid vaginal film. 1. Wash your hands with soap and water. 2. Cut the three sides of the pouch using a clean scissor. 3. Remove the film from pouch and roll it as shown in the picture. 4. Get into a comfortable position to insert the lactic acid vaginal film using dry fingers. You may want to squat, put a foot up on a chair, or lie on your back. 5. Push the film into the vagina. 6. Wash hands after use. 7. For best results, use at bedtime. Don't hide any vaginal-related issues. Consult your doctor timely. An initiative by Vidita. Your true companion.
So the dose of the film is one thin film at bedtime for 5 to 7 days. So this is the end of my presentation. Are there any questions anybody has?
Thank you so much, madam. We have received some questions. I just asked them.
Yeah.
Madam, in your experience, does the result change if you use the film at night or in the day, during the day? Or is it best at night?
It is best at night, but sometimes it can be difficult in a woman who is sexually active. In such a case, it's always better to advise them to put it in the morning at the daytime. It doesn't change any results.
Okay. And the next question is, when you actually prescribe the film, when you sense a particular pH is going to change or when the patient is under active infection?
So basically, when patients are coming, one condition which we commonly would prescribe would be a recurrent vaginal infection if she has, or even if she has recurrent vaginal complaints. Okay. Sometimes patients are very sensitive. Before an overt or a clinical infection sets in, if they have even vaginal complaints, sometimes just by giving lactobacillus support, that infection can be, the symptomatology can be taken care of. And definitely, if you have given some antibiotic for some other reason as an adjuvant to ensure that the vaginal flora will not get disturbed or will get maintained. And also, when you have already given her a treatment for vulvovaginitis, as a maintenance post this treatment, we would consider giving this film.
Okay, it would help that way.
Yeah.
And generally prescribe for 5-7 days?
Yeah.
For best results?
Yeah, 7 days at least it should be given.
And 7 days at least. And madam, once you prescribe the film, how soon you see the symptom relief?
It will take at least a week or so. Symptom relief may be earlier, but usually we call the patients for follow-up after a week. By
after
that,
a week.
Usually done, yeah.
Okay. And these vaginal wash which are available, do they irritate the vaginal lining?
Vaginal washes are not recommended, sir, because, I would say that probably vaginal wash have done one important thing. And that is they have made us understand that the important felt need, which women want to have some vaginal hygiene products.
Correct.
That awareness increase, that you need to maintain your vaginal health, you need to maintain, clean it, and therefore we must, thank and be grateful to these products for. But then using these products is not the solution because they may contribute to altering the vaginal pH.
Absolutely.
They may take away your friendly bacteria. So this understanding is important. Now, sometimes patients have a very poor vaginal hygiene, like very, very poor perineal hygiene. Then in that case, very, very selectively you may consider, because that if the smegma is very, stuck to the skin, you can't use any, by simple water, it won't come out. So in such a case, they may use some of these washes, which have been found to be, easy on that particular skin. Now, both these things, the wash and the film that we are talking of, have two different actions. This particular film is for restoration of the vaginal health and the pH balance and the flora, while the wash is to clean away something which is not there. So that understanding is very important, because sometimes patients then may double up using these washes for vaginal douching, which is not right.
That's right. And moreover, the washes, the dose would also change. Every person will use
There's nothing like a dose in a wash. So we can't compare Celerium to the wash at all. It's a totally different mechanism and different purpose. It's not a replacement.
No.
Not a substitute for each other.
Not a substitute. And the patients, when they say, how easy do patients find using the film, or difficult to find?
Now that only time will tell us, because now we have just started using it.
It's too early in the day.
Yeah, it's early in the day. One of the most important prerequisites to using it is the hands have to be dry.
Absolutely.
Because if your hand is wet, then placing that film inside the vagina can be tough.
How safe you to think, madam, this intimate hygiene is during early pregnancy?
It should be safe, because that is the time when the pH changes, and that unnecessarily cause a breeding ground for infections to happen. So I think it should be safe, because it doesn't have any absorption or systemic affection.
And madam, do you think this film will interfere with post-delivery episiotomy healing?
I don't think so.
No,
My concern is
likely.
that it will maintain the vaginal pH during pregnancy when it becomes exquisitely acidic, whether natural flora get destroyed. So you can consider using it to maintain or restore the vaginal pH in pregnancy and maybe prevent a premature rupture of membrane, which is quite an important cause and concern that we have, because bacterial vaginosis is also very, very common in pregnant women. So in such situations, you may consider using it.
And this was a very interesting question. Would this film give similar protective effect in candidal bacterial infection?
Yeah, of course it will.
Be, no? Because I mean,
I know candidiasis occurs with exquisite acidity, and therefore we feel that maybe it may cause increase of. See, your body has wonderful mechanisms to balance things out.
Balance, correct. I think that's all, because we'll wait for some more questions as they come. This treatment, this film can be used with concomitant treatment, active treatment, like say metronidazole or whatever you're giving.
If you're giving it orally, yes. Locally, no.
Yeah, then it will interfere, of course. Well, madam, I think that's all we have for the time being. Thank you so much. In case you have some more questions, we'll come back to you.
Sure. Thank you so much.
Thank you so much, madam. Have a wonderful evening. Thank you all. Thank you, participants.